help us understand the significance of an abrasion, and let me try to show you for, I think, what's been entered by way of stipulation exhibit 250. See if that's a different angle of that same left shoulder.
It is, however, some of what you're seeing here is before the body has been washed off, and so some of what you're seeing in this area is some blood mixed in with this area of abrasion that's occurred on his arm as well.
Do you have an opinion as to what caused that abrasion, doctor?
Yes.
Can you tell ladies and gentlemen what that is?
My opinion, this is from the bus striking him.
On his left side?
On his left side.
Okay. Let me show you what's been entered by way of stipulation exhibit 251. See if you can tell ladies and gentlemen of the jury if you see anything of value or interest on that.
This is his left arm, and on his left bicep there was an area of contusion, but it's not very well pictured in here. What you can see in this, though, is that he had a medical intervention where they attempted to save him.
So, by that, am I to understand that at some period after the accident there were first responders or somebody trying to work on Dr. Chiavani, and that's what their folks are seeing in Exhibit 251?
Well, I'm not sure who put what medical intervention on, but he has had medical intervention done, whether it be by first responders or him getting into the hospital.
And on his left ring finger, do you see a wedding ring?
Yes, I do.
And just above that in the photograph, if I move it down, can you see anything of note on his left hip?
Yes.
Tell the ladies and gentlemen of the jury what you see and what you think it is.
On the left lateral aspect of his hip, there's essentially a contusion, and that would be a bruise of his hip, and it actually does have some quality of abrasion to some scraping.
Do you have an opinion to a reasonable degree of medical probability what caused that abrasion contusion?
Yes.
What was it?
Being struck by the bus.
Ladies and gentlemen of the jury, Dr. Gavin, have heard that the initial impact was with the left side of Dr. Chiavani's body and bike to the right side of the bus. Is that consistent with what you're seeing in the examination you did and photographed?
Can you repeat that, please?
Sure. We've heard evidence that it was the left side of Dr. Chiavani that initially made contact, he and his bike, with the right side of the bus. Is that consistent with what you're seeing in the photographs?
Yes, it is.
I'm going to show you what's been entered by way of stipulation exhibit 252 and to help the ladies and gentlemen of the jury understand what this particular photograph depicts.
This is his leg, and it appears to be his left leg, and also there is an abrasion down near his knee on his near his left knee, essentially.
And the abrasion to the left knee, do you have an opinion as to what caused that?
Yes.
And what is your opinion?
Being struck by the bus.
Would the injuries that you've described in the exhibits that I placed before the jury have caused the doctor pain?
Yes.
And would they have occurred before he expired?
Yes, or around the time of his expiring.
To show you another radiographic image, which has been entered by way of stipulation of exhibit 247. Let's see if you ask you to help the ladies and gentlemen of the jury decipher what you as a board-certified forensic pathologist see in this CT or image. What kind of image is it, first of all?
This is a radiograph, an X-ray. And
of whom, Dr. Gavin?
Of Dr. Chiavani.
And what is it you see in the X-ray of Dr. Chiavani?
Essentially, he's facing towards that wall in this X-ray. You can see his skull, and then you see these lines that are occurring through the skull, and they almost have a center point, and then there's additional lines that are extending out from that as well. And these are skull fractures, and it's essentially portions of this skull fracture are depressed and kind of pushed into the side of his skull like it's smashed. And in addition, I noted a possible atlanto-occipital dislocation in here.
Help us understand what that means.
It's hard in this particular radiograph, and I did not have them retake this radiograph, but you can see how his jaw is slightly angled, so it's tilted, whereas you're not looking at it straight on. You can actually see the whole edge of his jaw. Because of that, his head is tilted, and so it alters this area when you in the radiograph. So an atlanto-occipital dislocation is when this is called the Atlanta joint, is essentially the top joint of your spine, your cervical spine. And then occipital is the name for the back of the skull. And if those become disjointed from each other, it's an atlanto-occipital dislocation. And because of the angle of this radiograph, I had said that it's possible that it's there, but it's not confirmed or probable because of the angle of the head in this particular radiograph.
So you told the ladies and gentlemen of the jury you can see skull fractures, and you pointed those out. Is that fair?
That's correct.
And are those skull fractures conclusions you reached as to the injuries sustained by Dr. Chiavani?
Yes.